Take 5 for Eyes, Episode 3, recorded February 8th, 2014, Making a Spectacle of Myself.
Hi, my name is Dr. Barbara Jean Fluder of Fluder VisionCare, and welcome back. Today what we're going to talk about is how are your glasses made? Have you ever wondered when you pick out your frame and we call you several days later and say your glasses are ready, and you pick them up and you put them on and I can see this is wonderful. Have you ever wondered what's behind all that, how we actually make those? Well, we're going to go over that today. We here at Fluder VisionCare have what's called a finishing lab, and I do all the making of the glasses here. We're going to go over how that's done and kind of educate you today as to how your glasses are made. So without further ado, let's begin. When you come in and you've picked out your frame, we then write up the order with your prescription. If you remember one of our previous videos, we talked about your prescription. We talked about astigmatism. We talked about nearsightedness and farsightedness. Well, there are numbers that we determine, and again, that's gone over in one of our previous videos as well. That prescription is written on an order. That order is then placed to our lab that we use to order what's called our lens blanks. And here is a sample of a lens blank. Okay, this is a large circular lens, and this has a prescription that is placed in it, your prescription that is placed in this lens, and we then receive these lens blanks, and your order is what we call trade up. We put the order with the frame in here. Your name is placed on the outside of this so we know who it goes to. The frame and the lens blanks come into our office here, and then I proceed to take this tray over to our finishing lab that we started in 2009, I believe we put in our finishing lab. And when those lenses come in, again back to this lens blank, that lens is first, before we ever cut the lens, it's examined. We look for any scratches in the lens, any defects in the lens. We check to make sure that the prescription in the lens is correct. After that, that lens is then placed in what's called a lensometer so that we can set what's called the astigmatism. Remember, we talked about this in the previous video. I can rotate that lens at any axis, and we dot that lens. In other words, I mark that lens where that astigmatism is so I know how to cut that lens and place that in the edger. That lens is then blocked. Here is an example of a blocked lens. The lens is then placed in the edger, and that edger then clamps that, if you will, clamps that block into place. All right, and we will then turn on the edger. We put in what's called your PD measurements. We will center the lens with the center of your pupil in the center of that frame. Okay, so that's part of the blocking process, and then when that's placed into the edger, that's then clamped in by the edger on both sides, and this is then rotated to cut out the lens according to the shape of the frame. All right, your frame that you pick out is also traced by that edger so that the lens is then cut out for the shape of that frame. And there are different grooves on the finished product, on the lens, to put it so that it fits in your frame. I have here one example of a bevel. This is a V-shaped bevel, and that is what goes into a full rim frame. This is a full rim frame, the one I have on my face. So the bevel on that is a V-shaped bevel, and that is what is placed. That's how it's placed. That's how it's held in place in the frame. Okay. If a patient has a semi-rimless frame where they have frame in the top and what we call an eye wire, for lack of a better description, is very similar to fishing line. The bevel is then grooved into the edge of the lens so that that eye wire, that fishing line, will then slip into that bevel. Okay, so there's different bevels we can put on these lenses, and it depends on what frame you have picked out. Most plastic and metal frames have this V-shaped bevel. Again, the semi-rimless and drilled rimless frames have a groove cut into the lens. There are different types of lens materials that we will order, and this is very important because it depends on your prescription for one, and it also depends on what frame you've picked out. Patients who pick out either a drilled rimless where there is no frame, or one where there's a frame on the top and then that fishing line, okay, that invisible, if you will, frame in the bottom, those will need a more sturdier lens, if you will, what we call a higher index or a polycarbonate lens, so that when we string that lens into the frame, it doesn't flake or chip. I have some examples of some lenses here. And let's show, here's a lens blank of an individual with a significant amount of nearsightedness and astigmatism. This is a regular plastic lens, all right? And if you look, you can see how thick this lens blank is. So that's a plastic lens, someone who has a lot of astigmatism and a lot of nearsightedness. Now, remember that thought for a minute, because we're going to move into what a polycarbonate lens material will look like. The same prescription, but in polycarbonate. This is a lighter, thinner lens material, and you can already see, in fact, let me get the other one out for comparison. Here's that plastic lens, here's that polycarbonate lens. You can see the difference. These are exactly the same prescription, but look at how much thinner and lighter. That way you can't tell how much lighter it is, but you can see how much thinner it is. Okay, I can tell that it's lighter. Let's go one step further. Let's go into what's called a high index lens. This is actually a plastic lens. However, it's very strong, and it's even thinner and lighter than the polycarbonate. Look at the difference between the plastic lens and the high index. Look at the difference in the quality of the lens. Hopefully you can appreciate this. I mean, this is just a much sharper, clearer, cleaner lens, if you will, than the plastic. And here's the difference between the high index again and the polycarbonate. Again, you can appreciate, hopefully this is even thinner and lighter yet. So there's different quality of lenses, and that's very, very important depending on the prescription you have and the frame that you've picked out. You don't want to pick out a wonderful frame and then have plastic lenses and just have them unsightly. You know, we want fashion and we want function. Okay? So that's a little bit about some different lens materials. And all of these lens materials are cut on my edger. So when the lens, remember I just told you, we put that lens into the edger after we've blocked it. Remember, we've marked the astigmatism, we've blocked the lens, we put it into the edger, we cut that lens. When that lens comes out of that edger, it's going to look like this, okay? Assuming the patient's frame is the shape, okay? So this comes out, this block will still be on at that time. I will then take that lens out of the edger, and if it's a plastic frame, I'll actually heat up, like take for instance my frame. I'll actually warm this frame up just slightly to loosen that plastic up a little bit for me to then pop the lens into the frame, okay? Once that lens is secured into the frame, I will then use a tool to de-block that lens after it's been cut, okay? That just pops right off there. Doesn't do any damage to the lens at all. That lens is then, as it's in the frame, two things I do. I inspect the lens. Again, we want to make sure no scratches, no chips, nothing like that, no defects in the lens. And then that lens also, along with the frame, will go back into that lensometer that we talked about in one of our other videos. That'll go back into that lensometer and we'll read that prescription to make sure that that astigmatism correction is where we originally placed it when we started the blocking process. hopefully that gives you some idea as to what we do here in Fluder VisionCare. Our edger went in 2009, and we have been very busy with our cutting. Generally speaking, our glasses we usually have them ready in about a week. Some of the insurances, you may say, well, wait a minute, my glasses didn't take a week, my glasses took 2 or 3 weeks. That's because not all of the glasses that you buy here are made here. A lot of your insurances will dictate where those lenses are made. If we are able to make them in-house, generally speaking, we have them back within a week. I think that concludes our video for today. Thank you again, and we'll look forward to seeing you again at Fluder VisionCare. Thank you.